Hi, my name's Matthew Links. I'm the Discipline Lead for Medicine here at Bond University. And today I'm talking with Ravi Balakrishnamoorthy regarding the important topic of child protection. This is part 2 of a conversation about how to learn ethics in clinical placements focused on paediatrics. We're coming today to you from Complementary Country. I hope you enjoy this conversation. Ravi, one of the issues that often comes up in paediatrics is the issue of child protection. Would you like to make a comment about how to learn and how important that is?
Yeah, so I think the ethics in pediatrics kind of exists on a bit of a spectrum, or ethical challenges. It can be something a little bit more on the simpler side, like consent. Can get a little bit more complex when we talk about those family dynamics. Gets even more complex when we talk about adolescence and consent and family dynamics. But I think in my personal practice, the most significant end of that spectrum is the child protection sphere. It's something that I'd argue all clinicians will be encountering at some point, and that is regardless of whether you do pediatrics as a career or whether you do adult medicine or general practice, or even if you're a completely adult physician and never see a child for the rest of your clinical career, this will absolutely come up. So I guess we know that there are different types of abuse or child protection concerns. We know about the common ones, or you'll get very clear guidance around the common serious forms of child protection, such as physical abuse and sexual abuse. That is almost indoctrinated into you when you complete your orientation to the hospital, and certainly throughout your medical school training. But the really challenging part, particularly in pediatrics, I find, is around the two other forms of abuse that can often go unrecognized, and that's emotional abuse and neglect. Because it doesn't often present acutely, it doesn't often present in a crisis, but it really is potentially that build-up of things underneath the surface that may not necessarily trigger your radar initially, but certainly come to the fore with time. And it's really challenging because by the time some of the issues around emotional abuse or neglect come up, you've had the opportunity to form a really close relationship with those patients and their families. A common situation that might arise is we might see a child in the hospital with an acute medical condition. We realise there's a need for outpatient clinic follow-up. We see them in outpatients, maybe once, maybe twice. We realise the complexity of their medical concerns, but then by that time, you've developed a really close relationship with the family. You understand their family dynamics. You understand the biological, the psychological, and the social. But let's say maybe they don't attend follow-up appointments. Maybe their compliance with your therapy plan isn't quite being followed. Perhaps alternative things are happening. Perhaps there are newer social concerns that have come to light since your initial meetings with the family. We talk about family stress, we talk about domestic violence, we talk about parental addiction. These are all areas that don't often present to us acutely. And that is a really challenging sphere to find yourself in, because you can appreciate that those psychological and social factors really do impact upon this child's health. And the child's health is in part deteriorating as a result of that. But then you form this relationship with the family. And it's really challenging to balance that, to balance caring for the patient, caring for the family, but also protecting the child and protecting the family. So it's about, at what point do you cross over from being a caring clinician that wants to support this family to potentially saying, I'm really worried, I need to make a report to child safety.
Yeah.
It's a really challenging sphere, and there's no hard and fast rule to this. But what I'd encourage students to do is think about those patients that might have those more complex psychological and social factors. Think about those patients that don't attend. Think about those patients where perhaps the parent or the family member had a negative interaction with the clinician on the ward round or in our patient's clinic. And think about how could you manage that? How do you move forward with protecting the child, protecting your relationship with this family, protecting that professional relationship, but also protecting the child? It's a really challenging area, and I think it's not until you're in it that you really know how to approach it. But I encourage that reflection early on, because it's a really daunting process to change that professional relationship into one where that relationship can get fractured.
Yeah, the as an adult physician, I think when you were talking about the fact that these issues come up and we're deeply led into people's families, not always in ways that are related to their to the illness that they're presented with, and so we're implicated in not detecting the thing. So the people's ability to learn from their experience and develop those skills of awareness and really emphasize, validate and back you up on how important that is for whatever you're doing. It seems to me that the thinking of it and noticing is the first step. In these hard situations, you're always going to get advice, and you can always contact a senior colleague and discuss what to do about it. But that step of noticing, of thinking of it, etc. Do you have any advice on how students can get into increase their awareness of this as an issue?
Yeah, I mean, obviously a lot of it comes through being on the wards, exposing yourself to these more complex discussions, not shying away from it. But also, I think we've all been in those situations where an interaction occurs or an encounter occurs where you just feel a bit uncomfortable. And I think I think both of us can probably attest that we feel that fairly commonly in our jobs. But it's important, and I can probably reflect on when I was a student and thinking, when there was a bit of an awkward or an unusual interaction between a patient and the clinician, or the family and the clinician, I went, ooh, glad that's not me. But really sit with that discomfort. That's a really important sign that your brain is trying to learn something. When you feel uncomfortable, that's a sign that there is something to be reflected upon here. There's an opportunity for learning. So I think a lot of it just comes from exposure, but also mentoring, having that opportunity, whether it's with a formal mentor or even a peer-to-peer discussion, or maybe discussion with your partner or housemate about, oh, geez, this was stressful. What would you do? Or what would I have done? Yeah, so it's about just starting that reflective journey early.
Yeah. Are there any stories or movies or the accounts of this that you would recommend that are impactful, and that you'd recommend for art as a way to increase awareness? Sometimes stories are powerful, and sometimes the stories come from patients, and sometimes they come from outside. Is there anything in that space that you would recommend?
Oh, it's a really challenging one, isn't it? Because, I guess when we think about child protection, for instance, it is not something that is out in the media. It's not something that's commonly discussed because it is distressing. I don't know if you'd necessarily find this in a book or in a movie. Certainly it'd be really controversial for audiences. So I personally have not come across outlets, you know, that I could learn from this or have that opportunity to experience. I could probably say that a lot of the complex family dynamics and consent issues and, you know, to an extent, some of those child protection concerns are really very strongly highlighted when we're dealing with pediatric patients towards the end of life, which is a really saddening, scary, unknown part of pediatrics. And hopefully students have the opportunity to see children that are unfortunately going through a really challenging time. We think about patients, particularly, you know, at Gold Coast University Hospital in our pediatric ward, we often service patients with cancer, pediatric patients with cancer. We also have a lot of complex care patients that are on a palliative care pathway. And I know that it takes a bit of self-reflection to think about what that might be like for that patient and that family. But there's lots of media available for people to understand what it's like for a child with cancer or a child on a palliative care pathway, or what it's like for their parents or for their siblings. And I encourage you, as saddening as it can be, to really access those resources, whether that be educational videos, books about children that are going through a cancer journey. I think these are really, really important opportunities to sit with that discomfort and to realize what everyday life must be like for patients and families at that point. So yeah, I think there's lots of resources available. They're not comfortable by any means, but sometimes sitting with that discomfort is really important.
Yeah, thank you. That's a point that's you've sort of brought up powerfully. I think in a few contexts that the sitting with discomfort is a real opportunity for learning. Certainly, as an oncologist, that's something I would emphasise as well. I guess the thing that the piece I saw recently that impacted on me about child neglect, etc., related to the recent death of Sinead O'Connor and the account of her deprivation as a child.
Yeah.
Was really powerful, and again, not easy to sit with, but I think easy to switch off in a way. But the understanding her story was certainly impacted on me and explained, I think, a lot about how things unfolded for her in later life. So highly recommend people sit with that uncomfort and explore that space. Well, thank you very much for your for that contribution. There's a lot there for students to think about and learn. And I think it's a key part of us learning to be better, more ethical, more caring, and more patient-centered. That we're able to deal with these really hard issues. So thank you for your time. And if students are interested in what has been discussed or found this discussion helpful, I'd point out that there are other podcasts in our series that deal with other similarly challenging and I think really interesting issues. Thanks for your time.
That's great. Thanks so much, Matthew. Appreciate your time.
No problem. Well, I hope you enjoyed that conversation and are inspired to learn more about ethics in practice. Listen also to part 1 of this conversation where I discuss with Ravi the common ethical dilemmas in paediatrics, or I'd encourage you to listen to other videos in this and other related series on our Vimeo channel. If you're a Bond student, look up the resources on Learning and Practice page on iLearn, and here are some other video and journal resources you might find useful. Good luck.